Hello and welcome to the Johns Hopkins Comprehensive Transplant Program's Introduction to Kidney Transplant. Throughout this presentation, I will be answering a number of different questions that you probably already have. Why have my kidneys failed? What is the process to receive a kidney transplant? What can I expect after my kidney transplant? We'll go through each phase of this process and then some throughout this presentation. Please know that you will have plenty of time during your official evaluation appointment to ask questions to our wonderful transplant nephrology team and your nurse coordinator. So here we're going to discuss the basics of why your kidneys are so important. Your kidneys remove waste products from your body. They also remove drugs or other pharmaceutical agents from your body. They balance the body's fluids. They release hormones that regulate blood pressure. They produce an active form of vitamin D that helps promote strong, healthy bones, and they control the production of red blood cells. Now that you understand why your kidneys are so important, it's important to understand what renal failure is. When you hear us use the word renal, we are referring to your kidneys. This is also known as end-stage renal disease, or most commonly seen as ESRD. ESRD, or renal failure, is caused by other health problems that have done permanent damage or harm to your kidneys. Most common causes of renal failure are high blood pressure, also known as hypertension, and diabetes. So now that your kidneys have failed, what are your options? You have two options here. One, you can start dialysis. There are two different modalities of dialysis, either peritoneal, which is a tube in your abdomen, or hemodialysis, which requires a graft or a fistula to filter your blood. The second option is kidney transplant, and that's what we're going to focus on through the rest of this presentation. Here are a few basic facts about kidney transplantation. In the United States, there are about 99,000 people waiting for a kidney transplant. On average, the wait time for a deceased donor kidney transplant is anywhere from 3 to 6 years. Each year, almost 5,000 people die on the wait list while they're waiting for a kidney transplant. And over 20,000 kidney transplants are performed annually. Here are the basic steps listed to undergo a kidney transplant evaluation. First, you'll start with the initial evaluation, and if you're listening to this presentation, you already have that scheduled. Next, you will complete the lab work and additional testing with the assistance of your nurse coordinator. Your nurse coordinator will present your case to selection committee to approve you to be then waitlisted for a kidney transplant. There are a number of different individuals that make up the entire kidney transplant team, some of which you will meet during your initial evaluation for a kidney transplant. First, you will meet with a transplant nephrologist. A transplant nephrologist is somebody who's specifically trained to manage patients who have received a kidney transplant. You will also have an opportunity to meet with a surgeon at some point through the process. You will be assigned a social worker. A social worker is incredibly important to address the psychosocial needs, such as transportation, housing, and a caretaking plan. You will also be assigned a nurse coordinator. Your nurse coordinator will be the glue that essentially holds this team together. You will also be assigned a finance coordinator that can address any insurance concerns that you may have. And you'll also be assigned a nutritionist that can address any dietary concerns that you have. Once you've been assigned a nurse coordinator, it's important that you save his or her contact information in your phone. Like I mentioned before, your nurse coordinator is the glue that holds the team together, so it's important to keep your coordinator informed of any major medical issues that have been going on through the evaluation. Here we're going to discuss the risks and benefits to receiving a kidney transplant. In the mail, you received a large white folder that contains the entire informed consent document. By signing the last page of that consent, you are stating that you have been informed of the risks, benefits, and alternatives to receiving a kidney transplant. The alternatives to receiving a kidney transplant is dialysis. Our job is to determine if your benefit outweighs the risk of receiving a kidney transplant. The benefits: longer survival, improved quality of life, living life without the requirement of dialysis, and overall you feel better. So the benefits naturally surround having a better quality of life. There are a number of risks associated with receiving a kidney transplant. First of all, it's a surgical procedure. Anytime you undergo anesthesia, there is a risk associated. The second risk is the lifelong immunosuppressant medication that you will be prescribed after receiving your kidney transplant. Lifelong, meaning the rest of your life, you will be prescribed a medication. The medication is called an immunosuppressant. If you break that down, you see the word immuno, which is immune system, suppressant. So we are giving you a medication to suppress your immune system. Our immune system was set up to attack anything foreign that enters. In this situation, the body is set up to naturally attack the kidney transplant. So the purpose of the medication that we will be giving you is to suppress your immune system so that you do not have the natural response to reject the kidney transplant. So it's incredibly important to understand why you're taking this immunosuppressant medication, and it's important to take it every single day as prescribed by your doctor. There is also a risk of rejection, that your body just naturally rejects the kidney transplant, or this will happen if you stop taking your medications. Chance of malignancy, which is another word for cancer, because of the immunosuppressant medication. Risk of infection because of the immunosuppressant medication. Graft failure, and death. Through this evaluation process, you'll be working with your nurse coordinator to complete the lab work and additional testing. Lab work will include 2 separate copies of your blood type that are drawn at 2 different times. The additional testing for most patients includes a stress test. Normally it's a dobutamine stress echocardiogram, or a nuclear stress would suffice. A resting echocardiogram, a chest x-ray. If you're over 50, you will be required to do a colonoscopy if you haven't already done one in the last 5 to 10 years. If you're a female or you have the proper anatomy, you would need a mammogram and a pap smear, a CT scan of your abdomen and pelvis to assess the vessels in your belly. And at times there are consultations necessary. We have a transplant psychiatrist that we might ask you to meet with, a transplant cardiologist that we might ask to consult. You are not required to complete the testing or consultations at Johns Hopkins, but this is where it's important to communicate with your coordinator. If you have not done the testing at Johns Hopkins, there's a chance that your coordinator will not receive the testing. So it's very important to keep in close contact with them once completed so your coordinator can request the documentation. After you've completed the necessary testing that we've required of you for your kidney transplant evaluation, your coordinator will present your case to the selection committee. Each week, the transplant team meets to discuss patients who have been evaluated and completed their necessary testing to approve them for a kidney transplant. Your nurse coordinator will call you with the outcome of this meeting. Once you've been approved, you will then be listed in the United Network of Organ Sharing. There are a few statuses. Status 1 is active, cleared for organ offers, and you are accruing time in the United Network of Organ Sharing. Inactive is status 7. That means you're accruing time, but you are not eligible to be called for organ offers. This could be due to pending testing or current medical, financial, or psychosocial status. There are reasons why patients are not a candidate for kidney transplant. A few possible absolute contraindications are advanced cardiovascular disease, which is an umbrella term for your heart, your lungs, and your vessels might not be healthy enough for a kidney transplant. Active malignancy. There are certain forms of cancer, such as prostate cancer, that we could essentially transplant you with, but most cancers must be in remission before we consider you for a kidney transplant. Active substance abuse. If you test positive for a drug screen, you will be required to complete some sort of therapy before we clear you for a kidney transplant. And a prohibitively high body mass index. Usually anything above 40 is considered prohibitively high, and we will ask you to lose weight prior to transplanting you. Here we're going to discuss the different types of kidney transplants. First, there is a live donor kidney transplant, and second, there is a deceased donor kidney transplant. Deceased donor kidney transplants can last an average of 11 years, and live donor kidney transplant can last an average of 19 years. First, we'll discuss how you receive a live donor kidney transplant. A few important things to know about live donation. It's considered the gift of life. You do not need to have the same blood type to donate. It's important that you know that because there are so many different ways that we could get you a live donor kidney transplant. If someone has expressed interest in donating to you, you need to listen closely and give them the information in order for them to come forward as a donor. 1 in 4 Americans would donate if they knew someone in need. A few different types are direct donation, where the person who has expressed interest in donating to you directly donates their kidney. Non-directed donation is considered an altruistic donation, where someone comes forward out of the goodness of their heart and wants to donate a kidney to somebody. And then there's the paired kidney exchange, or the swap program. This is why it's important to know that you don't need to have the same blood type as your donors, because you guys could be entered in the paired exchange program. So, how do you find a live donor? It's important that you share your story, whether that be through social media, through your church group, through your community bulletin. Regardless of how you do it, share your story. Like I mentioned before, 1 in 4 Americans would donate if they knew someone in need. So make a list of people to tell your story to, and includes friends, family, people from church, school, social groups, work groups. Some people may not know. Get the word out and find yourself a champion, somebody who can tell your story on your behalf if it's uncomfortable for you. Share your need and post your interests in finding a live donor on your social media platforms. Encourage your friends and families to share through their social media platforms to increase the number of people that share your story. Here are a list of resources for recipients about live donation. The NKF is a wonderful website. The United Network of Organ Sharing is another great website. And there's a research opportunity here called the Donor app. You can sign up and list Johns Hopkins as your transplant center, and you will be called for further instructions. This app will help you write and share your story about needing a kidney transplant. Likely you've received this copy of the PowerPoint through a PDF version, so you can either click the link through the PDF or you can type in the URL. Now that you've shared your story and you've found someone who's interested in donating to you, the donors need to reach out to the donor office either through our website, which you can either click on the PDF version of this PowerPoint, or you can type it in through the URL, or they can call 410-614-9345. It's important to understand that the donor needs to make contact with the donor office in order to start the process to donate a kidney to you. There are a number of benefits from receiving a kidney transplant from a live donor. First of all, long-term survival is markedly improved among patients who receive a donor kidney compared with patients who remain on dialysis. When a recipient has a live donor, the waiting time for transplant is significantly shorter, and the transplant can be scheduled. It's incredibly convenient. Live organs that are transplanted last twice as longer than cadaveric organs, which we'll talk about next, and live organs begin to function much more quickly than cadaveric donations. This also frees up a cadaveric kidney for another recipient. The surgery for the person who is donating a kidney to you, the live donor surgery, is a laparoscopic robotic procedure. The recovery time is 48 hours in the hospital. You're discharged to your home. You can return to work in as little as 4 to 6 weeks. There are no dietary or physical activity restrictions. We just recommend a healthy diet. Are there any costs associated to the donor? Everything that is covered under the recipient's insurance are the evaluation visits, the diagnostic blood work, diagnostic testing, the surgery, and post-surgical care. Anything not covered is travel expenses and any unrelated medical conditions. As I mentioned previously, if your donor is incompatible with you, like they have a different blood type, an option for you is the paired kidney exchange. Another name for this is the kidney swap. This occurs when the live donor is incompatible with the recipient, and so exchanges kidneys with another donor and recipient pair. A good visual to see is what you see on the screen. The incompatible match is on the top and another incompatible match is on the bottom. But the donor 1 is compatible with recipient 2, and donor 2 is compatible with recipient 1, so they swap. I hope you have a good understanding of the live donor process at Johns Hopkins Hospital. At this time, your donors can get more information and fill out an application by visiting our website or by calling the donor office at 410-614-9345. Next, we will discuss how you receive a deceased donor kidney transplant. A deceased donor kidney transplant is offered to patients on the wait list from someone who has passed away or deceased. Contrary to the short waiting period for a live donor, the average wait time for a deceased donor kidney transplant can be anywhere from 2 years to 6 years based on your blood type. There's a system in place to distribute kidneys from patients who have passed away to recipients that are waiting on the wait list. It's called the allocation system. Allocation refers to how kidneys are distributed to recipients on the wait list. In March of 2021, a new system was implemented. Kidneys will now be offered to recipients listed at transplant centers within a 250 nautical mile fixed distance circle from the donor hospital. This will reduce geographic effects on transplant access. I will show you a map next of donor hospitals within a 250 nautical mile fixed distance to Johns Hopkins Hospital. Additional allocation points based on how close your transplant hospital is to the donor hospital will be applied. There's also a website on the bottom of this slide that will easily lay out the changes to the allocation system, so feel free to visit that website to get further clarification. Here is a map of the majority of the East Coast, and this shows us donor hospitals within a 250 nautical mile fixed distance to the Johns Hopkins Hospital. In the middle of the map, you will see a red dot. That is where Johns Hopkins Hospital is located. The little blue dots are all the donor hospitals within a 250 nautical mile distance to Johns Hopkins. There are patients who get priority access to deceased donor transplants. Pediatric patients, anyone who has ever donated a kidney and now needs a transplant, and patients with failed dialysis access. It is more important now than ever to make every effort to find yourself a living donor. Now that you understand the process to get listed for a kidney transplant and you understand that there's a significant wait time for a deceased donor transplant, we're going to discuss what happens when you get to the top of that wait list and you are coming up for organ offers. So if you are called for an organ offer, please keep in mind that a few other patients are also called as well. We have a target patient and then we have a backup to the target patient. At times, patients are called into the hospital for tight time constraints but later discharged. Surgeons may view the organ upon arrival and decide that it is not transplantable. You may be brought in as a backup and never get the organ. Also keep in mind there is no penalty for declining an offer. Now we're going to discuss the different types of deceased donor kidney transplants that can be offered to you. High Kidney Donor Profile Index, or high KDPI, donors with identified risk criteria, hepatitis C positive donors, and hepatitis B core positive donors. High Kidney Donor Profile Index is an estimate of the quality of the kidney. It's a percentile ranking from 1 to 100%. The lower the number, the more likely it will be a better quality organ, and the longer it is likely to last. There are a number of donor factors that are considered in this calculation. the older the age, height and weight, ethnicity, history of hypertension and diabetes, the cause of the death is factored in, serum creatinine at the time of death, hepatitis C status, and donation after cardiac death all weigh into the estimate of the quality of the kidney, or the KDPI. Your coordinator will ask, are you interested in accepting a kidney that came from a patient with those donor factors that were just listed? Are you interested in accepting a high KDPI kidney? This graph shows the survival benefit of using high KDPI kidneys versus waiting on the wait list. All to say that there is always a survival benefit for accepting a high KDPI kidney over waiting on the wait list while on dialysis. Please remember there is no penalty to declining an organ offer, so signing up for high KDPI kidneys will only offer the kidney to you, and you can decline it if you are not interested when it is your turn. If you're interested in calculating your score or your survival benefit for accepting any types of kidneys, this transplantmodels.com is an excellent resource for you. You can calculate your survival benefit for using high KDPI kidneys, donors with identified risk criteria, or even receiving a kidney transplant during this COVID-19 pandemic. Now that you understand what a high KDPI kidney is, we would like to explain what donors with identified risk criteria for HIV, hepatitis C, and hepatitis B infection. A potential organ donor is considered having identified risk criteria if any of the below occurred within 30 days before organ recovery: sex with a person known or suspected to have HIV, hepatitis B, or hepatitis C infection, man who has had sex with another man, sex in exchange for money or drugs, sex with a person who had sex in exchange for money or drugs, or sex with a person who injected drugs for non-medical reasons, drug injection for non-medical reasons, incarceration for more than 72 consecutive hours, and unknown medical or social history. The long-term survival after transplant from these donors is the same as organs from donors without identified risk factors. The identified risk factors are all referring to the social behavior of the donor. The potential benefit of accepting a donor with identified risk criteria is to shorten the time that you have to wait for a transplant and reduce the chance that you may become too sick to be transplanted or die before receiving a kidney transplant. The risk of missing an infection is felt to be around 1 in 10,000 to 1 in a million, depending on the risk criteria. While this risk is very low, we feel it is important for all organ recipients to know that a small risk does exist, and for this reason, all recipients will be tested for these viruses after transplantation. In the very rare instance of infection transmission, effective therapies are available. A few additional factors to consider. It's important to sign up for all types of kidneys. Remember that KDPI is an estimate of the quality of the kidney. It is a mathematical model. A kidney biopsy is performed on all high KDPI kidneys, and it is the ultimate test of quality. A nucleic acid test, or NAT testing, is a sensitive viral marker to determine the presence of any infectious diseases. All transplant recipients will be tested for hepatitis B, HIV, and hepatitis C infections after transplantation, and should transmission occur, effective therapies are available. Now that you've learned about high KDPI kidneys and donors with increased risk criteria, next we'll talk about hepatitis C virus positive donors. Advances in antiviral medications have led to a greater than 98% cure rate for hepatitis C infection. These advances, coupled with the high discard rate of organs from hepatitis C virus-positive deceased donors, has led the transplantation of organs from hepatitis C positive donors into a hepatitis C negative recipient. After transplant, recipients are treated with direct-acting antiviral medication for a period of 8 to 12 weeks to cure them of hepatitis C transmission from the donor. The benefit of accepting a kidney from a hepatitis C positive donor is a shorter wait time and a higher survival versus waiting on the wait list. Now that we've discussed high KDPI kidneys, hepatitis C positive kidneys, and donors with increased risk criteria, we will discuss donors that were exposed to hepatitis B virus. This means that the donors were exposed to hepatitis B virus in the past. There is no active hepatitis B virus. The virus, however, can be found in the liver and rarely in the blood or kidneys of the donor. There is a small risk for hepatitis B virus transmission to the recipient. These organs are usually offered to candidates that have been immunized or have developed antibodies against hepatitis. Your hepatitis labs will be drawn during your evaluation. Recipients are treated with medications against hepatitis B until blood tests for the virus are negative. After you've received your kidney transplant, there's a chance that you could have delayed graft function. Delayed graft function is when there is a low urine output and the need for dialysis within the first week after transplant. It can occur in about 50% of deceased donor transplant recipients. Most common donor and recipient risk factors are high donor serum creatinine, low donor urine output at the time of transplant, long out-of-body or cold time, and low blood pressure on the recipient during the transplant or thereafter. Are you a type 1 diabetic or a brittle type 2 diabetic? If so, you might be interested in a simultaneous kidney and pancreas transplant. You may qualify for a simultaneous kidney and pancreas transplant if you have end-stage renal disease and diabetes that is difficult to control. Difficult to control is blood sugar that swings from high to low, often without warning, or frequent admissions to the hospital for diabetic ketoacidosis. The average wait time for a simultaneous kidney pancreas transplant is about 1 year, which is significantly shorter than a kidney alone. There are other types of pancreas transplants. There's a pancreas transplant alone, or a PTA. That's when a pancreas-only transplant is performed on patients with type 1 diabetes and no kidney problems. A pancreas after a kidney transplant happens when a patient who has type 1 diabetes and end-stage renal disease has a living donor kidney transplant. In this case, the kidney transplant is performed first using the live donor's kidney, and then the patient waits for a deceased donor pancreas to become available. Now that you've learned about all the different types of kidney transplants, live donation, deceased donation, the types of deceased donor offers, let's talk about what happens after you received your kidney transplant from either type of donor. One of the most important things to understand after you've received your kidney transplant is that you will be prescribed a number of different medications. The most important thing for you to understand is the lifelong immunosuppressant medication that was mentioned previously. There is a risk of birth defects with the immunosuppressant medications. So females and males of reproductive potential should consult your transplant team regarding pregnancy prevention and planning. You will also be prescribed infection prophylaxis, multivitamins, antacids, blood pressure medications, diabetes medications, diuretics, and pain medications, which are hopefully temporary. You will be provided a significant amount of medication education during your hospital stay. The recovery is in the Zayed building on the 9 West floor. The expected length of stay is 2 to 3 days following a live donor transplant and 3 to 7 days following a deceased donor transplant. If your kidney has delayed graft function, you can go home on dialysis until the kidney kicks in. Complications or medical issues can prolong your hospital stay. You will be assigned a post-transplant coordinator. A nurse coordinator will help guide you after you are discharged post-transplantation. The follow-up appointments are on a schedule, usually once a week, every other week, and every third week after discharge. Frequent lab monitoring and medication dosage monitoring happens after transplant as well. Also, to note again that females and males of reproductive potential should consult their transplant team prior to pregnancy due to the increased risk of birth defects while taking the immunosuppressive medication. This will be a good time to discuss with our social work team what your post transplant care looks like. You will need to identify a caretaker, someone who's going to be with you for the first 4 to 6 weeks after transplant. You're also going to be able to identify a transportation plan, so somebody who's willing to take you back and forth to and from appointments and lab draws for 4 to 6 weeks after your kidney transplant. If you live out of state, it is important to identify and secure housing for after transplant so you don't have such a long drive for your appointments. Thank you so much for tuning in to our kidney transplant education. You're going to be evaluated by the medical, surgical, and psychosocial team to determine your candidacy for transplant. Your nurse coordinator will arrange for necessary testing to determine your eligibility. Your case will then be presented to the committee, and if medically and socially accepted, you will be listed for a kidney transplant. In the meantime, try to find a live donor and contact your coordinator with any further questions.